Reid Wilson, Epidemic, Ebola and the Global Scramble to Prevent the Next Killer Outbreak. Epidemic, Ebola and the Global Scramble to Prevent the Next Killer Outbreak by Reid Wilson takes a hard look at the 2014 Ebola outbreak in Africa and the unique challenges faced in restraining its spread. The book reveals the vulnerabilities and cultural quirks that accelerated the contagion as it delves into the Herculean efforts by various nations and aid organizations. You will gain important insights into the extraordinary conditions under which healthcare workers and medical researchers operated, while the world scrambled to prevent a global pandemic.
Ebola, the deadly virus. Ebola virus, discovered in 1976 near the Congo River in Africa, is one of the deadliest germs to have ever been seen. It can kill up to 90% of people it infects, causing high fever, diarrhea, vomiting, and discharges from eyes and nose. This virus can spread easily through the tiniest of entry points, including small scrapes on skin, and it was always confined to remote parts of African countries. In these places, victims would die too quickly, and outbreaks would fizzle out without spreading the disease to new areas. Despite warnings sparked by the bestseller The Hot Zone and Outbreak movie, immunologists remained confident that Ebola would stay a rural scourge rather than an urban blight. However, the fear was always there: what if the virus arrived in a large city? The deadly Ebola outbreak. In 2014, an Ebola outbreak began in West Africa, and it quickly spread beyond the remote villages where previous outbreaks originated. The virus was transmitted through contact with bodily fluids, including those of deceased individuals, and cultural practices such as washing the bodies of the deceased facilitated the spread of the disease. Misinformation, distrust of medical workers, and a preference for traditional healing methods also contributed to the outbreak's spread. The virus, a product of natural evolution, claimed the lives of thousands in West Africa and eventually spread globally, highlighting the urgent need for improved global health infrastructure. Deadly outbreaks in West Africa. In 2014, the Ebola virus spread to Guinea, Liberia and Sierra Leone, creating a deadly epidemic in West Africa. The region, which has a long history of slavery, colonialism, and civil war, lacks basic infrastructure, including healthcare facilities and medical personnel. Despite the rapid spread of the virus, governments in the three countries were hesitant to begin public health campaigns, fearing a drop in trade and tourism. While they had some initial success containing the virus, it quickly made its way into large cities with international airports. The lack of proper healthcare made it difficult to accurately track the virus, which led to a global pandemic possibility. The article highlights the importance of having proper healthcare infrastructure to deal with future outbreaks, as well as the need for faster international response to contain these kinds of infectious diseases. Ebola outbreak in West Africa. The book highlights the adverse, primitive conditions foreign doctors and aid workers encountered as they worked to contain the Ebola outbreak in West Africa in 2014. In the summer of 2014, the Ebola epidemic ravaged West Africa, presenting a significant public health crisis. In response, foreign doctors and aid workers arrived to stem the tide. However, they encountered challenging working conditions, including sweltering heat and humidity that made it difficult to operate machines and perform tests. Blood tests for Ebola were also problematic, as results were often ambiguous, making it challenging to provide accurate diagnoses to patients. False negatives were potentially deadly, leading to infected individuals unknowingly passing on the disease to others, while false positives meant patients would be sent to an Ebola ward where their chances of contracting the disease were nearly inevitable. Moreover, the Ebola virus proved to be incredibly deadly for healthcare workers who treated patients. The primitive healthcare infrastructure in West Africa, where hospitals were often tents or shacks, further compounded the issue. Medical facilities lacked basic necessities such as latex gloves, leading to the reuse of supplies. Donning plastic bread bags or other improvised materials became the norm for protection. The lack of air conditioning also caused a challenge, with doctors and nurses having to lift protective goggles to dry condensation inside, exposing themselves to the virus. These conditions eventually led to the deaths of doctors and nurses, including Sheikh Umar Khan in Sierra Leone, who became a national hero for his treatment of Ebola patients. The book reveals the significant challenges foreign doctors and aid workers faced during the Ebola epidemic in West Africa. It highlights the need to prioritize public health infrastructure in countries with frequent outbreaks and provides insight into the complex nature of disease outbreaks and the need for global cooperation to mitigate them. ZMapp, a potentially effective Ebola treatment. Despite having no official cure for Ebola, one possible treatment is through transfusions using the survivor's blood which contain antibodies. ZMapp, an experimental drug that was effective in treating Ebola in chimpanzees, but untested in humans, raised international debate over whether it should be used to treat patients. Dr. Kent Brantley responded remarkably well to ZMapp within an hour, but Nancy Wright-Bowl showed signs of an allergic reaction to the drug. Unfortunately, a Spanish priest who received a full course of ZMapp died. The head of the U.S. Centers for Disease Control, Tom Frieden, claimed that 2 or 3 patients were too few to conclude ZMapp's effectiveness. Nigeria's successful Ebola response. In the midst of the West African Ebola crisis, Nigeria successfully prevented the spread of the disease when Patrick Sawyer, a Liberian carrier of Ebola, traveled to Lagos. Nigerian health officials had already recognized the threat of Ebola and trained their healthcare workers and immigration officials to detect the disease. When Sawyer arrived in Lagos, a customs official spotted his symptoms and the Nigerian health system immediately began collecting and analyzing data to track down anyone Sawyer had come into contact with. Due to a stroke of luck, Sawyer was taken to a small private hospital where he potentially infected fewer people. Nigeria's public hospitals were closed due to a strike, which helped prevent an outbreak from occurring in densely populated Lagos. Ultimately, the outbreak was limited to just 20 cases and 8 deaths thanks to Nigeria's aggressive and swift response. The successful containment of the Ebola virus in Nigeria demonstrated the importance of preparedness and efficient public health measures in combating the disease. Ebola outbreak response. The Ebola pandemic that started in 2013 in West Africa exposed the inadequacies of the global public health system. The outbreak led to a massive international response. The U.S. alone earmarked $100 million to fight the disease and sent troops and CDC workers to the affected regions. Other countries like Germany, China, and Italy also contributed to the $3 billion international aid that arrived in West Africa. Despite the overwhelming response, health workers found it challenging to isolate Ebola patients since just 18% were in hospitals. To encourage more people to seek treatment, who suggested using clear plastic for tent hospitals so relatives could see what was happening inside. American officials' 70-30 strategy aimed to isolate or partially isolate 70% of Ebola patients. Even with this approach, the task was Herculean, given the high number of Ebola patients. The outbreak exposed a need for a more comprehensive global public health strategy. The arrival of Ebola in the U.S. In 2014, Thomas Duncan traveled from Liberia to the United States with Ebola virus disease, EVD, which he contracted while assisting a sick pregnant woman. Despite his high fever, Duncan was initially sent home from the hospital without being tested for EVD, and he subsequently infected 2 nurses who cared for him. Fortunately, they received blood transfusions and constant monitoring, which saved their lives. This incident highlights the importance of early detection and quarantine measures when dealing with communicable diseases, even for individuals traveling from areas with low disease transmission rates. The devastating 2014 Ebola epidemic. The 2014 Ebola outbreak claimed over 11,000 lives and uncovered the inadequacies of the world's health systems. While the combined efforts of the WHO, U.S. soldiers, and CDC staff contained the outbreak, the favorable location of the epidemic facilitated their work. Ebola, though deadly, is less contagious than airborne mosquito-borne diseases. The heroic efforts of health officials and aid workers were instrumental in combating the outbreak, yet it revealed the world's unpreparedness for preventing such outbreaks. Ultimately, luck played a significant role in curtailing the virus, but this may not be the case in future.
Reid Wilson's Epidemic calls attention to the devastating effects and critical lessons learned from the 2014 Ebola outbreak. The book highlights the world's glaring unpreparedness in the face of such a deadly disease and the remarkable efforts by professionals and governments across the globe to contain the epidemic. Though the outbreak was eventually controlled, it exposed the inadequacies of the global healthcare systems and the pivotal role of cultural practices in the spread of the disease. The book serves as a stark reminder that, unless the world takes the necessary steps to improve its preparedness for potential pandemics, we may not be as lucky in the future.